Hello, Fernley. This is your Mayor, Roy Edgington. I want to take a few minutes today to provide you with an update regarding vaccinations for our senior population here in Fernley and to talk about where we are in this pandemic today. The COVID vaccination is now available for seniors 70 and older who reside in the Quad Counties. Proof of residency and an age is required to provide, so be prepared to provide a driver's license or paperwork documenting your current address and date of birth. Seniors can receive the vaccine at the Quad County COVID-19 vaccine events. Again, these are scheduled events, so you'll have to call and make reservation. Having said that, we understand there's a lot of frustration out there right now. Since this announcement was made by the governor on January the 12th, Carson City Health District has been overwhelmed with an influx of calls on their hotline. In addition, their website has been overwhelmed due to the number of people trying to schedule appointments for vaccine. The City of Fernley is working with Lyon County and Carson Health District to help people get registered for vaccinations. Please be patient as we work through this. The community will receive information as we move forward. We understand folks are frustrated, and we want to assure you we are doing what we can to help voice our residents' concerns. For questions or to make an appointment, you can call the Quad County COVID-19 hotline at 775-434-1988. Again, that's 775-434-1988. There is also a website to schedule appointments, which we include in the post with this video, and you can find it on the city website. Please be advised there is a significant delay for both the hotline and the website. According to the county manager, they received on the first day 1,500 calls in one day. Okay, it overwhelmed them. So please be patient. Call them, leave a number, and they'll get back with you. We're working through this. During the governor's press conference on January the 12th, he announced a 30-day extension to the current mitigation measures in place. To review this list, you can find them on nvhealthresponse.nv.gov. Again, you can go to nvhealthresponse.nv.gov. Nevada's COVID-19 vaccination program playbook for statewide operations was submitted to the Center for Disease Control on October the 16th. Since that time, the playbook has been updated twice as more information is received from the CDC and the FDA relating to COVID-19 vaccine. We must remember that this pandemic is a public health issue. It is having significant impact on our regional hospital and healthcare providers. Lyon County residents occupy hospital beds in Reno, Carson, Fallon, Yerington, and Minden. When those beds are unavailable, then our EMS personnel have longer waits at hospitals, surgeries get delayed, people wait longer in ER waiting rooms, healthcare providers get sick, and you reduce the staff. Those impacted are also taxing our local EMS and first responder. We have seen an increase in calls up to 25%. In addition, some of our EMT personnel had been exposed and had to take time off for 14 days in quarantine. This can have a ripple effect on all of us. I would like to again ask everybody listening right now to please help our first responders, our healthcare providers, by following the simple suggestions. If you are sick, stay at home. Again, if you are sick, stay at home. Use social distancing, avoid close contact. Remember to wear your mask and face covering. Wash your hands often. Cover your mouth and nose when coughing or sneezing, and avoid large gatherings. This pandemic will not last forever. The more we help by following basic public health principles, the sooner we can normalize. I want to thank you for all you're doing that you can help keep yourself and your loved ones safe and healthy. Again, I want to remind everybody that before this pandemic, we had a national health crisis by not having enough physicians and nurses. Again, having a pandemic on top of the normal calls has just stretched our healthcare providers beyond what we can normally handle. So we're working on that. So please be patient. Please follow the safety protocols, and please understand that we're just kicking this off. Giving shots take a lot more time than just taking a sample. You drive through a line, you do the paperwork, you hand it, you get your nose swabbed, and you're off. When you give a shot, somebody has to do the paperwork. We account for all those shots. In addition, you have to stay 15 minutes afterwards to make sure you don't have an allergic reaction. So it's very labor intensive for us to do that. So please be patient. We are working with the state, we are working with the county, and as we get dates and times, they'll become available. In addition, private physicians are now starting to get the COVID-19 shots available to them as they start signing up for that. I thank you for your time. Please be safe. Please stay healthy.